be unsafe. And so we ask, if you are in a position where you are sliding on the road and you feel it's unsafe to get to work, to please pull over on the side of the road and call TLC immediately. Some things that TLC feels that you should have in your car for bad weather are, we would like you to have a blanket, a flashlight, a granola bar, some mittens, a hat, a car charger, a phone charger, as well as a shovel in case of any emergencies where you are stuck in a snowbank. We are in Vermont, so it could happen, and we want to make sure that you have the things you need in order to contact us, and also to help you get out of a jam. You are all mandated reporters, and what that means is that you have a duty to please inform APS, Adult Protective Services, as well as TLC, if you have any suspicion of abuse. That abuse can be financial, physical, psychological, it can be emotional abuse, it can be abandonment, neglect, or self-neglect. In any case, it is your responsibility to make sure that you inform both the case manager at TLC as well as APS, Adult Protective Services, if you have any suspicion of abuse. Any employee of this agency who has reasonable cause must report suspicion of abuse. No person required to report elder abuse will bear criminal liability for reporting suspected abuse. No person will bear liability for reporting suspected abuse unless the person knows the report is false. When 2 or more people are required to report a case, they may reach an agreement to have one of them make that report. No supervisor or administrator may impede or prohibit reporting. The identities of those filing reports is kept completely confidential. The employee reports suspicion orally or in writing to the nursing supervisor. The report will include name and address of client, name and address of person or facility responsible for the care of the client, the nature and the extent of the client's condition, and any other relevant information. And lastly, the nursing supervisor will complete an abuse and or neglect evaluation. Your job description is as follows as an LNA. You are a professional member of the healthcare team whose primary responsibility is providing supportive nursing care under the supervision of a licensed nurse in accordance with the Nurse Practice Act regulations of the State Board of Nursing, and this position reports to the licensed nurse. You must possess valid current licensure under the State Board of Nursing, be responsible, mature, possess general knowledge of the disease process and basic standards of personal care. You must possess knowledge of necessary actions in emergency situations. You must be able to effectively communicate with the client, their significant others, and the nursing supervisor. You must be in good physical and mental health, and you must complete the agency's employment process. And you can see that when you are working in a facility, you will be using your LNA license accordingly. TLC has an incredible commitment to coworkers, code of conduct, and ethical behavior. And this is how we conduct ourselves in the office and with our employees. As your coworker and with our shared goal of providing excellent care to our clients, I commit to the following. I will accept responsibility for establishing and maintaining healthy interpersonal relationships with you and every other member of this team. I will talk to you promptly if I'm having a problem with you. The only time I will discuss it with another person is when I need advice or help in deciding how to communicate with you appropriately. I will establish and maintain a relationship of functional trust with you and every other member of this team. My relationships with each of you will be equally as respectful regardless of job titles or levels of educational preparations. I will not engage in bickering, backbiting, and blaming. I will practice caring, committing, and collaborating in my relationship with you, and I ask you to do the same with me. I will not complain about another team member, and I ask you not to as well. If I do hear you doing so, I will ask you to talk to that person. I will accept you as you are today, forgiving past problems, and I ask you to do the same with me. I will be committed to finding solutions to problems rather than complaining about them or blaming someone else for them, and I ask you to do the same. I will affirm your contribution to quality care to our clients, and I also will remember that neither of us are perfect, and that human errors are opportunities not for shame or guilt, but for forgiveness and growth. Regarding OSHA, OSHA is a program that is designed to keep all of our employees safe. TLC is committed to maintaining a safe and healthy environment for all employees. You must report all accidents, injuries, potential safety hazards, safety suggestions, and health and safety related issues immediately to your supervisor. All employees should refer to the client's plan of care for appropriate techniques for lifting and transfers. You must not push, pull, or lift more than 50 pounds at a time. And it is important that you also know where the MSDS is. The MSDS is our material safety data sheets. And what that is that it is the list of chemicals in the facility that you're working for. And that is the #1 state survey question for Vermont, is where is the MSDS and what is it? So please make sure that you know where the MSDS is in order for you to be able to answer that question appropriately. It is important that you follow our back safety rules, and that means that you must be following body mechanics as best as you possibly can. You must make sure that you plan your lift when you are lifting. You need to clear your path, make sure that there's no obstacles. Your feet should be shoulder width apart. Be sure to lift smoothly using a suitable lifting technique. Please never ever twist your body when lifting. Simply pivot your feet. And remember that you must have the load as close as possible to your body at all times when lifting. Keep your spine aligned with natural curves and maintain the S-shaped curve in your back. You are not allowed to bring any religious or faith-based items into a client's place of residence or a facility. If the client asks you to read any kind of religious material and you're comfortable doing so, we are completely fine with you doing so. However, if you're not comfortable doing so, please contact TLC. Everyone involved in planning and caring for your clients wants your relationship with your client to be successful, and that means that we really need to be thinking about who we are caring for. We are caring for the elderly, and these people have possibly gone through the Depression and experienced multiple recessions. What that means is that it's possible that they are uncomfortable with discussing money. And we ask that none of our employees speak with their clients about money. Some of our clients don't understand that we are spending $800 on iPhones or $125 on Nike sneakers. Therefore, we do ask that you not bring up the subject of money with your clients. If your clients are concerned about the cost of our services, we ask that you please direct them to call billing at TLC. Remember to respect the individual. Cultural and environmental differences between employees and clients sometimes exist. However, you can discover shared interests, values, and understanding common to you and your client. Remember to act friendly and positive. A smile and a friendly attitude go a very long way towards keeping a great relationship with your client. If you are working with somebody who is hearing impaired, it's important that you are in front of the client, that you are speaking a little louder, a little slower, and positioning yourself to the better ear. Please do not raise your voice or shout in somebody's ear, as it will distort the words that you are using. Practice patient listening. Remember, many older people, they love to reminisce. So we like you to listen, and this will give great confidentiality to your communication. It forms a basis for trust, and many older people will place a great deal of value on respecting confidences. Be patient and understanding. Remember that you are caring for a client because of an illness or a disability, whether that be Parkinson's, where it takes an extra 4 minutes to get up out of a chair, or whether it be Alzheimer's disease, where it takes an extra 37 seconds to find a word. It is about them steering the ship. The only time when that would not be appropriate is if the client was unsafe to themselves or others. Customer service is extremely important. 96% of unhappy customers don't complain to you, but they will tell everyone else. And we do know that bad news travels fast. We all seem to talk about negative experiences rather than positive ones, and it's very important that you understand that you are representing our company, TLC, and therefore we want you to be the best you can possibly be in order for us to have a great reputation and for us to be able to say that we provide excellent customer service. So please remember, when you are working for TLC, that you are representing us, and please be as professional as possible. For infection control guidelines, assume that all blood and bodily fluids from all patients are potential infections. Hands must be washed before and after contact with each patient and before preparing food. Hands must be washed under a steady stream of warm water with soap or antibacterial fluid for at least 20 seconds, and then you must dry your hands completely with a disposable paper towel. Gloves are to be worn when you have any contact with blood or bodily fluids, and those fluids can include but are not limited to feces, emesis or vomit, urine, oral secretions, respiratory secretions, and secretions from open wounds. When gloves are removed, hands need to be washed thoroughly again. Gloves never take the place of hand washing. When you are removing your gloves, you're going to be grasping the palm of the glove and placing it into the other hand, and then peeling off the glove and turning them inside out. Never ever reuse your gloves, and certainly discard your gloves when you are finished with them. Bed linens, towels, and clothing soiled with urine, stool, or bodily fluids should be placed in a plastic bag and tied shut until ready to be laundered. Wash all soiled items in hot soapy water and dry on high heat. Dispose of urine, stool, and emesis by flushing in the toilet. Clean bedroom or commode bucket and rinse with a 1 to 10 bleach solution if you are working with commodes. And make sure that you use a fresh solution daily. Make sure to dispose of your gloves and incontinent padding in a sealed plastic bag. Wash all eating utensils in hot soapy water. And if you are working with needles, syringes, or sharps, we ask that you never recap them, and make sure that they are placed in the containers that are in your facility. Please write "do not recycle" or "biohazard" across a container if it is a home container. And place it into the household trash. Personal protective equipment, we will be providing you a box of gloves, as well as we will be providing you masks or any PPE that is needed in order for you to do your job safely. We do have aprons, gowns, protective eyewear, face shields, and masks up in the building here, and if you need anything, please do not hesitate to contact us. With regards to our cell phone policy, your phone must be put on vibrate or buzz, and your phone must be with you at all times. We ask that you please give the phone number 802-735-1123 to anybody who would possibly call you while working. The reason for this is that we do not want you to answer your phone while working unless it is TLC that is calling you. You are never ever to use your phone to text, social media, games, research, email. 100% of your focus must be entirely on the client at all times. We also do have a Facebook page that I encourage you to join, and our Facebook page is Team TLC. This is what's happening with TLC out in the community and our educational offerings. You will be following the smoking policy at your facility. And with drugs and alcohol, we have no tolerance for any drug abuse at TLC. Employees may not be under the influence of or use any alcohol, intoxicant, or narcotic on the way to work or while performing duties for TLC nursing. It is important you understand at any time if we feel that drugs or alcohol is impinging your job, that we have the right to search your personal property, and you must cooperate fully with those searches. If you work 52 hours for TLC, we will offer you 1 hour of free paid time off. But please make sure you understand that when you do leave TLC, you will not be paid out any of your time. So if you do have time on the books, it's important that you use it before you leave our company. Some policies for TLC staff are as follows. Never solicit money from any clients. For a school, social, church, or volunteer or charitable organization, do not accept money from a client. Do not accept any gifts from a client. However, this agency does recognize holidays and birthdays. If a client would like to express their appreciation on those times, please call TLC and get permission before accepting any gift. Do not assist the client with any financial matters. It is illegal for anyone other than a licensed professional, an RN or an LPN, to administer medication. Do not discuss matters relating to a last will and testament with the client. Never accept private employment from a client for whom you provided services through this agency during the preceding 1-year period. Do not accept any keys, including house, car, safe deposit box keys, unless your supervisor is aware. Never bring any unauthorized individual into the client's home. Do not drive the car of a client or your own car with the client in your car unless HR and TLC is aware. Do not use the client's telephone for any personal calls unless an emergency arises. Under no circumstances are you ever to give out a client's phone number. Never give your own personal information to a client or a client's family. You should never give them your phone number, and you should never give them anything where they could actually look you up on social media and be able to contact you. If you are required in the course of your duties to make purchases for a client and the client provides you with cash for those purchases, you must obtain receipts for what you have spent. Do not use the client's credit card for any purpose. Do not consume or use alcoholic beverages or drugs prior to the shift or while on duty. You are to perform only the duties or provide only the care included in your job description or designated in the care plan. Do not leave a client's home during your scheduled hours without notifying the office before you leave. It is important that you never ever clock out when being asked to leave early. Instead, to please call and we will manually do so. You must immediately report to the office any incident in a home or institution involving an accident or an injury to the client or yourself, or any theft. You must provide your own food and beverage when you are working with a client. Employees are not permitted to smoke cigarettes or use any other tobacco products in a client's home, and certainly you will be following the smoking policy at your facility. Employees are never to cut toenails or fingernails. You are expected to arrive on time for your scheduled shift, and all scheduling is done through the office. All clients and their families are at all times to be treated in a courteous and a respectful manner. Always be tactful, diplomatic, polite, and cheerful when you are dealing with a client and their family. You must keep the client's affairs confidential and respect the client's privacy. Remember that HIPAA is a law. Our policy regarding attendance: no show is grounds for disciplinary action, possibly termination, and if you have 2 call-outs with or without proper notice, that is grounds for probation. Do not discuss your personal problems with a client or their family. And remember that cell phones are never to be used while engaged with a client. They are only to be answered if TLC is calling. If you choose to no longer accept assignments from TLC, we please ask that you give us notice in writing 2 weeks in advance of the last day that you wish to work, and to return your ID badge. And our goal is to provide the best care possible to our clients with the touch of tender, loving care, the TLC way. Welcome aboard.